And thank you for taking the time to join us today. We have Premier Scott Moe and Saskatchewan's Chief Medical Health Officer, Dr. Saqib Shahab. We'll have opening remarks from the Premier and the Doctor, and then we'll move to questions. Premier?
Reporting 60 additional cases in Saskatchewan, and a point of note, this is our highest one-day total to date. Almost all of the new cases are related to an ongoing outbreak in a number of Hutterite communities in southwest and west central Saskatchewan. In fact, nearly 3/4 of the new cases today are from one Hutterite community in the RM of Latonia. These case numbers are very concerning, but they are not entirely unexpected. This large number of cases was detected as a result of the aggressive testing and the contact tracing that the Saskatchewan Health Authority has been doing in a number of Hutterite communities in the province. And that work is ongoing. So it's possible that we may see similar case numbers in other communities in the very near future. Last week, Minister Kading asked everyone in the affected areas to take the following steps to protect yourself and to protect others, and to reduce the further spread of COVID-19. Stay in your home community as much as possible. Self-isolate and get tested if you are feeling unwell in any way. Self-isolate and get tested if you have been in contact with anyone who is known to have tested positive for COVID-19. And limit your interpersonal contact and group gatherings as much as you possibly can. For the most part, we have had very, very good cooperation with the Huttarian Safety Council, with community leaders and residents in following these guidelines and following them very closely. However, there have been a few isolated reports of individuals that have not been following these guidelines, and they have traveled outside of their communities for non-essential reasons, and even when they may not be feeling well. So we are in the process of speaking to all of the leaders of all of the Hutterite communities where there is a significant number of cases. And we are working with these local leaders to enact restrictions on all non-essential travel in and out of their communities. We are working with these local leaders in limiting the essential travel to a small number of designated individuals. This includes travel between Hutterite communities. We know there will still be some travel that will be required. So it's important for all of us in this province to not stigmatize or exclude members of this community or any other community for that fact. I have personally spoken with a number of these community leaders this morning, so have Minister Ryder and Minister Kading, and they all understand how important it is for us to work together to protect the members of their own communities and to protect their neighbors in surrounding communities. We've also offered the assistance of the Public Safety Agency, should that be required. Most of our success in Saskatchewan to date in controlling the spread of this virus has been due to, one, accessing a good public information from Dr. Shahab and his team, and two, due to the goodwill and the compliance of Saskatchewan people in following all of the safety guidelines that have been put forward. That is precisely how the community of Lalache and its neighboring communities were able to get their outbreak under control. And that is how we'll get this latest outbreak under control. So I want to thank everyone in that part of the province for what you are doing to protect yourself, to protect your family, and to protect your neighbors in your community. And I want to also take the opportunity to thank everyone in the rest of Saskatchewan. I want to again once remind each and every one of us that while these new cases are primarily in one area of the province, the risk remains in every area of the province. So we need to keep up all of the good practices that we have been doing. The physical distancing, the washing your hands, washing them often, using hand sanitizer, not sharing your food or your drinks with others, limit the number of personal contacts that you have outside of your household, and wearing a mask whenever physical distancing may not be possible. This is how we will continue to protect ourselves. This is how we will protect our family, and in particular, the elderly members of our family. And this is how we will ultimately protect our community and our province. So I want to thank everyone in Saskatchewan for what you're doing, and we will get through this. Dr. Shahab?
Thank you. So I'll just start by going over the numbers and then some further details. So as the Premier said, we have 60 new confirmed cases today for a total of 1,030, 2 in the far north, 1 in the north, 3 in the central part of Saskatchewan, 4 in Saskatoon, 50 in the south. and all those 43 are from one RM of Lawtonia. And of the 1,030 cases currently in the province, 190 now are active. So obviously over the last 5 days now, we have, through active case finding, there have been a significant number of new cases reported, and obviously cases remain active in general for up to 14 days after the onset of symptoms, but 840 have recovered. And as of today, 13 people are in hospital with 3 in intensive care. And again, there's always a bit of a lag between cases and hospitalization, but we are seeing generally a higher rate of hospital and ICU admissions in line with the increased case numbers. We have for some time now seen this shift of concern to southwest and central west parts of the province. Majority of the cases continue to be in communal living settings. And there are about now 17 hut-right communities with active cases in Saskatchewan. And this, of course, does not mean to suggest that the risk currently only resides in these communities. The risk is widespread. There are sporadic cases throughout the province. But we do know that in communal living settings, that is where you can get an explosive increase in cases. And what we've seen is, just like everywhere else, that when individuals who were symptomatic with COVID symptoms went for testing early on and isolated, even in a communal living setting, not sharing meals and not going to worship services while symptomatic, there were no further cases in that communal living setting. But where initial case finding did not happen, case numbers increased very dramatically and led to hospitalizations. And again, I would like to reinforce that while we focus on new cases, if you look at 3 communal living settings, one has a lot of cases, has moved into testing and contact tracing and is getting over that. That's what should happen. And the earlier people move forward for testing and case control investigation, the earlier they'll get ahead of the outbreak. You can have another communal living setting where there's no active cases, no one is ill, and that's really good. So you have to maintain that status by everyone needs to monitor themselves and their children. At the first sign of symptoms, seek testing, isolate. That's how you can prevent further transmission within the colony. And of course, the big concern would continue to be settings where there are cases who are not seeking testing, and over time you get a large number of cases and hospitalizations. So that's the situation we all need to work towards avoiding, whether it's a communal living setting or our own households or communities. And from that perspective, I think it's important to recognize that if a colony has posted that they have a COVID situation, like many colonies have, and they may be doing business a different way, like curbside pickup or other mechanisms, there should be no discrimination for that colony, just like there should be no discrimination for a business that announces that they had a staff member who is unwell or that's named in a PSA. We just need to manage that. Maybe our operations change for a few days, and then we get back to routine operations, as routine as you can in the age of COVID. And obviously there should be no discrimination broadly against the hut-right community or otherwise, because we need to have the trust, which is bilateral, that people who are symptomatic with isolate will not go out to conduct business, will not visit another colony if symptomatic, especially if they have an outbreak, because that's how transmission jumps from one colony to another. And even when there are events where otherwise we would be compelled to go, to drop everything and go, like a funeral or a wedding, we cannot go if we are symptomatic. And I think that has to be the same whether it's in a colony or between colonies, between communities, between households. All of us have stayed away because we didn't want to go to a funeral because it had to comply with restrictions that now are somewhat relaxed. But that still doesn't mean that you should visit if you are symptomatic or from a setting, either a household or a communal living setting where you have cases. I think you have to isolate and forego attending that funeral or that wedding. So I think these were my key messages, and I again wanted to emphasize that for all of us the message is the same, that we must we must isolate and seek testing if you're symptomatic, whether you're living in a household, whether you're living in a communal living setting. That is what's worked for us in the past. That's what will continue to work for us going forwards. And just want to know that we have seen significant increase in testing. I think it was more than 1,200 tests were done yesterday. So again, the testing capacity is there. Access to testing has been a bit of a challenge in terms of some wait times because of increased testing. That's being addressed. But I think isolating when you're unwell, seeking testing at the first sign of COVID symptoms, and then case count investigation will be the only way that we will be able to control this. Thank you.
Thank you, Premier. Thank you, Doctor. We'll start with questions in the room. Murray?
Use sweeping powers under the Public Health Act to impose restrictions, if I'm reading them correctly, include road blockades, including stay-home orders for communities and individuals. Some people suggest that maybe, if not using those powers, because it probably is better to work cooperatively, that perhaps the suggestion of using those powers might underscore your point. Are you thinking of using those powers? Are you thinking of suggesting the need to use those powers under a situation where you have an outbreak in a community where I'm guessing probably half the residents, if there's 43, are infected?
Those powers are there, and they will be used if it is required in certain areas of the province. In saying that, it is always better to work with the local leaders on how we can contain this spread. As we said earlier, the real tools of success that we've had in Saskatchewan have been the access to public information about how to control the virus, and then two, the willingness of people to comply with the recommendations that have been put forward by Dr. Shahab and others. What we did in the North is we worked with the community leadership in the North, and we actually provided funding in that case for some local checkpoints and some local restrictions that had been put forward by leaders in the North. As we worked our way through the weeks in that particular outbreak, we then brought in some of the provincial resources to replace some of those local resources in the travel restrictions that we had throughout the North. We're doing taking the very same approach here, working with the local leadership. As I said, ministers have talked to most, if not all, of the 17 communities. I don't think they've gotten a hold quite of all of them just as of yet, but the ministers are talking to all of them to work with them on some self-imposed restrictions, many of which are already there. But to ensure that the access, the flow of information is free and free flowing, and it has been good, but it needs to continue to be good, strong in the days ahead. But to also work with them on ensuring that they have a very fulsome understanding of what a self-imposed travel restriction does mean and how it is really a requirement for the success of containing the virus, not only in their community, but not spreading it to surrounding communities or other Hutter 8 communities as well. And we've also reached out to a number of other Hutter 8 communities that I know MLAs know as well. This is how we work through these outbreaks.
Can you expand on what that means? Does it mean offering them resources like trailers and things to alleviate the community living situation? Can you offer public assurances to the communities where the outbreak is the most sincere, that those communities are working with the government? For instance, is the community 43 one of the ones that you consider to be working in a productive way with the government? It would be sort of one way, obviously, to alleviate public concerns related to the Hutter 8 community that you unfortunately mentioned.
Yeah. No, the reception that I have heard from the ministers and the few that I have talked to, and I've talked to a few leaders myself as recently as this morning, has been very positive. They are very understanding of the threat that COVID-19 brings to their community. They are very understanding of the measures that they have taken and ultimately need to take to ensure that we can contain this virus. In saying that, as Dr. Shahab has spoken to, the communal living of in our Hutter 8 colonies is fairly. It's a positive environment for the spread of COVID-19, and so there is a lot of effort that has to be taken at the local level, and we're confident that the local leaders are taking that effort. In fact, some of the colonies where COVID-19 didn't originate, but where it first arose here in Saskatchewan, down in the southwest, are now finding themselves on the backside of their infection rate, as their infection rates are beginning to drop. and that is only happening due to the the positive decisions that they have made on colony to ensure that the virus is no longer spreading. If you have anything to add to that, but some of them are starting to drop, and that is a positive sign.
Yeah, I'll just say that, the Hydronic Safety Council has since March put up excellent information about how do you, for example, if you live in a communal setting, how can you serve food safely to families and groups in a way that you don't have everyone, eating together, because currently that you wouldn't recommend that as long as there's a pandemic. So there's some excellent resources that are culturally appropriate. I think some colonies have very successfully implemented that and remain COVID-free. Many colonies out of the 17 have had only 1 or 2 cases because they were quick. Everyone in the colony was well aware of the symptoms. They were quick to seek testing, isolate themselves in their immediate household, and then there was no further transmission. So even in a communal living setting, there's been more cases of success in limiting transmission even within a communal setting than examples of lack of success. So I think that's really important for colonies to learn from each other where that's been successful. And of course, there's lots of business and social connections among colonies. So again, there's been increased awareness of symptoms and why it's really important even if you're contact and you're asymptomatic, for you also to isolate yourselves for 2 weeks. So it is very challenging for all of us to do that. It's especially challenging when you have strong connections, family and otherwise, to stay away. But I think that is going to be essential to limit COVID transmission across colonies, and also from not impacting surrounding communities, because again, I think there are now examples that it is impacting the surrounding communities, and it's no one's fault. It's you are asymptomatic and you're attending to an important business matter, or you have social connections, or through places of worship or attendance and funerals. It is transmitting between colonies and in some cases in the surrounding communities.
And this is, just add this, the seriousness of this situation, and it is a very serious and concerning situation. Not only is this our highest daily infection rate province-wide, today we have a higher infection rate in one community than we have on any other day across the province, with 43 coming out of one community. So this is a serious day for all of us in the province. It's a day for us just to recall that COVID-19 is not gone, and most certainly is here. And if we let our guard down just for a moment, it will spread. And we're committed to working very closely with all of our colonies, all of our communities, including our Hutterite colonies. If there are any resources that they need, we will provide them in the very same way that we provided resources to the north. But first and foremost, among those is the dissemination of public information and ultimately the willing compliance of that. And I think we have come a long way with respect to both.
Take our next question, Steph.
Yeah. How long are you willing to wait to give colonies a chance to enact these further travel restrictions on their own before having to kind of put up roadblocks or be a bit more, I don't want to say heavy-handed, but take more of an intervention?
Each situation, each colony will be a little bit of a different discussion. So there wouldn't be a time limit on how long we'd be willing to wait until there was, for the next step or the next measures that would occur. But I think there would be a few things that would have to occur in order for that to happen. It would be, blatantly and flagrantly not complying with the travel restrictions that we're asking these colonies to put in place. Understanding there's still some essential travel that does need to occur in and out of the colony for food and for the business that they do conduct there each and every year, but we are asking them to greatly limit any of the non-essential travel, limit all of the non-essential travel in and out of the colony. Some of them have done that already, but this does include between colonies, and we know there's close tight-knit family relationships between colonies, and in the same way that this has been very challenging for many of us to not see family members in health care settings or long-term care settings, we're asking the very same of our our of the people that are living in Hutterite colonies here now. So it's not a how long would we wait until we took the next steps, and those next steps would be in consultation with whichever leadership group we were working with. But there would be some other items that would that would be of concern that we would have to step in. Most certainly our goal not to do that, and to date we have no indication that we would have to do that. We've had pretty receptive and responsive phone calls, in particular today, with the numbers that we see here today. This is if this doesn't get everyone's attention across this province, I would hope it does.
Follow-up?
Yeah, can you speak to what factors were at play for the one Hutterite colony that we saw 43 new cases today? What happened in that situation?
I would say the single largest factor, and Dr. Shahab, you can speak in much more detail on this, was the aggressive testing of the Saskatchewan Health Authority moving in and doing a significant number of tests in a community.
Yeah, and I think I just want to reinforce that. I gave the example earlier that it's better to have testing and have the high numbers and understand the transmission dynamics and get ahead of it rather than try to resist or maybe have a few days where, maybe it's not COVID and, you've got a couple of people who are unwell and it'll get over it. Because if you don't do that, it does grow very quickly. And I do want to say that, initially about 4 months ago when we first had our modeling projections, there was some questioning of, the modeling projections of if we were at business as usual, we'll see maybe a third of the population impacted within the first wave. And that's exactly what we're seeing, unfortunately, that all these small communal settings are a microcosm of what could happen if business as usual happens, where very quickly in 2 or 3 weeks you see rapid transmission, where a third of a communal living setting can get impacted. Unfortunately, that's the same high-risk issue that can happen in a long-term care facility, where if you're not cautious about preventing introduction infection in the first place and then not quickly isolating a person who's unwell in any communal living setting, whether it's a long-term care facility, personal care home, university dorm, or a communal living setting like colony, if you aren't very always self-monitoring about not introducing infection at the first sign of illness, isolate yourself, close contacts, you see rapid transmission. So I think this is a sobering reminder for all of us how successful we are if we want to control it, but how rapidly it can transmit if we are not vigilant about all those things.
That's an important point, whether it's an individual, whether it's a group of individuals or a Hutterite colony or another community or a business that comes forward and is being tested or has been tested and identified as having a positive COVID-19 member in their community or in their business. We shouldn't stigmatize people for doing the right thing. We shouldn't stigmatize businesses or communities for doing the right thing. We should actually be applauding them for that action. And if we look at and because they're trained, but if we look at the outbreaks that we have had and quite likely prevented in our healthcare settings, where they have been identified very, very quickly and isolated, those individuals that have been in contact with someone with the COVID virus very, very quickly, we have prevented, I would say that we have prevented much larger outbreaks in our healthcare settings. I think of the one in Prince Albert, the one in Lloydminster, one long-term care home in La Loche. So that is the extreme of trained professionals identifying when they have been in contact or when there may be a symptom and getting tested very quickly. And we should applaud that action, and we should applaud that very same quick action of testing, contact tracing, and isolating in our general community with people, with businesses, with whoever it may be.
Go to our next question in the room. Taylor?
Is it okay for cities and town councils to resume public meetings, or should Zoom or teleconferencing be made available to people if they want to avoid these public gatherings?
Sure. There's Dr. Shahab, you may speak in more detail to this as well, but the public health recommendations are there with respect to physical distancing recommendations, measures with respect to the number of people in a room, how large the room, and every incident is a little bit different, if you will. This room is a different size than maybe some other rooms in this building, and so that all has to be brought into account. But I would say whether it's a town council meeting or whatever it may be, whatever type of meeting it may be, if you are able to, abide by the public health recommendations that are in place, you should be able to attend, that type of an event. However, if you are not able or do not feel comfortable, you should take other precautions like wearing a mask, like continuing with Zoom options if they are there. I do all of those, wear a mask if need be, attend meetings like we are here today where we can appropriately distance. That's why we have 2 people up here, not, 3 with Karen, but that's why we don't fill this front, is so that we can have the appropriate distance. But I also take part in many video meetings as well. So anything to add to that?
I think I would agree with that. I think generally we have to understand that we need to maintain this new normal for the foreseeable future. So obviously it can't go back to crowded meeting rooms at all. And whatever we can do to thin out meeting rooms, and sometimes that does mean that everyone can't attend, and some can be in person, some can dial in, just as today.
Follow up, Taylor?
At least one preschool has said that they're not going to be opening up in the fall because of new guidelines. Do you have any comment for that and for other preschools that are kind of not sure where they're going to go this fall?
I wouldn't have much of a comment with respect to the preschool, and I'm sure we do have guidelines out for our preschools. That would be a choice of that individual operator, I suppose. We are putting out guidelines that we feel, whether it be for daycares, preschool, K-12 school, working also with our universities to ensure that we are able to return for those that choose in as safe a manner as possible at whatever level of education or child care that is required. And that is, that's what the guidelines are about, is trying to minimize the risk as much as possible for all those that are involved.
We'll take our next question. Britton?
I just want to get your thoughts. There's been some concern. A listener sent in that at the Saskatoon Farmers Market that the Eagle Creek Hutterite colony is there, and that is one of the colonies that have been listed today by the government. What are your concerns about that happening?
Are they at the farmers market?
I get that according to one of the listeners.
Well, I don't know if that's one of the colonies that the ministers have talked to here yet today or not. There is going to be, like I say, some essential service. We may want to have a discussion with them as to attending. The farmers market is essential, and we may want to look at that, Doctor. But on the other side of it, it may well be deemed essential as well, as they are. This is part of what our colonies do, is they do market. The fresh market vegetable sales market at farmers markets and to stores is part of the way that many people in this province make their living. And Hutterite colonies would be included in that as being part of the way that they generate funds for the people that reside there. So there may be some precautions or recommendations that we may provide around some of the essential travel that is occurring from a particular colony. These are not only homes, and not only do they practice communal living and very tight-knit communities, they are also very industrious areas where there are small industries that are taking place, from agriculture, from vegetable market gardening to fairly intense livestock operations as well. And we must respect the work and how they are making a living like each and every one of us are, but ensure they're doing so in a safe manner, so they're not putting themselves in danger, their family members in danger, and anyone else in neighboring communities in danger.
Follow-up question,
I haven't heard that specifically.
Apparently the farmers market is happening right now. You said you haven't been in contact. Was that concerning that a colony might be out and haven't got the proper direction from government? And then just another thing, because that was follow-up to that mostly, but are you doing contact tracing and testing in other communities that haven't been listed yet? Have you been going in and doing that?
Yeah, so maybe I'll speak to the farmers market first, and then the other. So I think, we all have to rely on multiple layers of protection, and I am aware that in central West Saskatchewan, several communities along with colonies have cancelled farmers markets just because of concerns with over COVID transmission, or paused for a couple of weeks till things settle down. But in general, a lot of business where you don't have direct, client-customer contact, and that's not a farmer's market. But other businesses like operations can continue safely, even if you have a 100 colony in an outbreak state, because you can do curbside pickups or deliveries that can happen safely. People can come into a colony or at a colony with appropriate PPE and pick up supplies. So none of this should impact the vast majority of commercial operations. Having said that, where there is closer interaction, like at a farmer's market, the principles should remain irrespective of if there's an outbreak or not. You shouldn't go to a farmer's market either as a person who is going there to sell produce or as a customer if you're unwell. And even if you go, we do know that even for farmers markets where it may be anyone coming to sell or buy, 20% of all COVID transmission is asymptomatic. So even at any farmers market, we should all behave in a way that we maintain that 2-meter separation. Wear a mask where we can't guarantee that 2-meter separation, even though they're outdoors, but some may be indoors. So I think all those layers increase our level of protection, and that will have to continue for the next little while. And the second point I think is really important is that there is no threshold for testing. And it doesn't really matter where you live in Saskatchewan, if you live in a communal setting. If you have any concern, there should be no threshold for testing. You should seek testing to inform yourself, your household, if you live in a communal living setting, everyone else. There has been some reluctance to test because there's been this sense that if we get tested and we find more cases, it draws attention to us as in this case, as a community that's otherwise visibly identifiable. And we need to all, understand that that is not the purpose of testing, and that should not deter individuals or communities from seeking testing. It's not a source of stigma. It actually helps you to actually reassure yourself and others who live within your setting that we don't have COVID, or if we have COVID, we can quickly isolate cases and prevent further transmission. So I think those are the principles, and I think those are the principles that will have to work for us for the foreseeable future, because testing today and being COVID-free today doesn't tell you anything about tomorrow. And so this has to be a constant self-monitoring and seeking testing, not just once, but any time you have concerns in an ongoing fashion.
We'll take our next question from the phone lines.
We have Adam Hunter with CBC.
Hi, I'm wondering if Dr. Shahab can explain how this has spread from one colony outbreak now to 17 communities. You mentioned things like funerals and weddings, but you must have done some active tracing to see sort of how this has gone from such a small space. And the public would probably like to know how it can be spread like this.
Yeah, thanks. So, obviously, as I mentioned earlier, we are working closely initially with our counterparts in Alberta, but now also with Manitoba and BC. Obviously, in Saskatchewan, connections are stronger between western part of Saskatchewan and southern and eastern parts of Alberta. There are some indications that potentially there could have been some initial exposures that may have been asymptomatic. If you're younger, you can have asymptomatic infection or infection that is so mild that you wouldn't even notice it. So there may have been some initial asymptomatic infections due to attendance at an initial search and rescue mission, or a funeral early on in maybe middle of June. There have obviously been other events, funerals and other events where again, no one really wants to go while they're ill and expose others. But again, asymptomatic transmission is recognized, and the way we interact, that's the real concern, that even in the general community, when for a time, people were not meeting their parents, not taking their children to meet their grandparents. And as we relaxed, we said, make a virtual bubble that's small, up to 3 households initially, now up to 5 households, 15 people. And then within that virtual bubble, you can be closer than 2 meters, but don't expand that. So as contact increases, we just need to be cautious of that. So I think because of the fact that there are strong family and social connections between communities, that's how transmission has been happening. between communities both in Saskatchewan and between Saskatchewan and Alberta, back and forth. And I think we just need to be a bit cautious, and it is hard. We all recognize how hard it is to stay, unless you're a close family member, how hard it is to stay away from a funeral when you've known someone for, most of your life, how hard it is to not go to that wedding. But I think those are some of the sacrifices that we've all made and need to continue to make, and that is really what will help all of us to prevent, some of these outbreaks from happening.
You have a follow-up question, Adam?
Yes, Doctor, yesterday you said we've seen places where, I'm quoting you, where people are close together for prolonged periods indoors where transmission happens. And today, again, it's a similar message with these outbreaks in these communal living settings. And I'm wondering how that's different from, let's say, a school setting, K-12 school, where people will be indoors for prolonged periods of time. And there are questions today about the precautions being taken for schools, given what you said about indoor spread.
Yeah. So obviously, prolonged close contact is a higher risk for transmission. One layer of protection of that is have some physical distancing, to obviously not go out to any location, outdoor, indoor, if you're unwell. And we already know that, in workplaces, as long as you don't go to a workplace if you're unwell, and at a workplace, as long as you maintain physical distancing, use a mask. When you can't do that, for example, when riding an elevator, we can minimize transmission. For schools and daycares especially, we've already seen in daycares that, children may not exhibit any symptoms, but if they do have COVID, they transmit less than adults. We have seen that, in general, we have not seen transmission in daycares, even though you can't always obviously maintain that physical distancing. Similarly, in the school setting, it is important to obviously not have large assemblies or other settings where you can have transmission. But within a classroom setting, at this point, the assumption is that because children are not efficient at transmitting COVID, and as long as they are one cohort or bubble of a classroom, we don't expect to see high levels of transmission within children. And what we've seen in other jurisdictions is that if there's been transmission in staff in schools, it's not been something that was generally happening because of exposure in the school setting. All of us, whether we're in healthcare or in education, we also live in communities. And in many cases, irrespective of our occupation, we get exposed just like everyone else when we're out and about. And I think that's been more of a concern. And then transmission horizontally among staff, either in healthcare or schools or other occupational settings where, you may be in between classes and not maintaining that physical distance. So I think those would be more important aspects to consider. But having said that, we will obviously watch closely. Public health will be working closely with schools to support schools. And if there's any clusters of transmission, we'll handle that quickly just to, prevent that becoming a bigger problem than it needs to be in a school setting.
We'll take our next question on the line.
We have Phil Tank with the Star Phoenix.
Yes. When you say, you're working with health authorities in Alberta and we've seen outbreaks in Manitoba, and you just mentioned BC, are you aware of continued travel between the provinces, since the original outbreak was reported in June?
So first of all, I just want to make it clear that for all of us in Saskatchewan, Alberta, BC, Manitoba, there was a time when non-essential travel was not recommended. Now, travel is permitted. So if you're asymptomatic, you're not in a setting, either household or communal setting where there's an outbreak, you can and can travel. But even when you travel, you have to understand that, if you go to your close family member, a parent or a child's house, you have formed that virtual bubble. So you stay at someone's house and you've agreed that, we are going to make this virtual bubble. But then, if you're invited to an event in another province, obviously that event has to comply with local guidelines, which currently are 30 for private events, indoors, outdoors in Saskatchewan. But if it's a ceremony with no food, it can be as high as 150. But you should only attend if you're asymptomatic. And even when you go there, you should comply with all guidelines around physical distancing. So, those things should be, an option for everyone, irrespective of if you live in a colony or you live in any community. But it's just following those principles and understanding that, if, for example, in any setting, if you're choosing to go and live with friends or family in their homes, even if you were not unwell, but you were asymptomatic but still transmitting, there is a slight risk that when you go and visit someone and stay in their house, or you see friends and family, there's a slight risk that there may be asymptomatic transmission that may happen, and that's just something we need to understand and accept. But as long as we keep our virtual households small, up to 15 people, if there was transmission, it would be limited to those 15 people.
You have a follow-up question, Phil?
Yeah, I'm not sure you answered my first question, like whether you're aware of continued travel between the provinces and whether any of these cases might be linked to more recent travel than June. And are there any other events you're aware of? You keep mentioning funerals and that. Are there any other events, or do you know for sure that some of these cases were linked to communal meals or prayer or anything like that?
So I'm just aware of maybe one additional travel to a funeral from Saskatchewan to Alberta, where there were some linkages to that event. But that's also even in March and April, not related to communal living settings. We saw that people had gone to another province to attend a funeral, and there was transmission that happened even then. So we already know that, when you are in a larger group and where you can't sometimes maintain that physical distancing, there is a transmission risk, irrespective of where you are and where you intend to travel. And we just need to be conscious of that. We need to minimize travel and maintain that physical distancing at those events. And we need to accept that in some cases transmission will happen. And I think at this point we are focusing on communal living settings, but throughout the last 4 months we have had transmission that's happened by attending weddings or funerals, in the general population, as well as obviously close, family gatherings where you agree to be as a virtual bubble, 15 people, or as an extended, if you're having a gathering up to 30, you all want to maintain that physical distancing, but sometimes you don't realize that you're getting closer than that 2 meter, or everyone's taking helping themselves from a single dish, and that's how transmission happens. So I think we have seen that. We all need to work towards minimizing those transmissions, but still accept that to some extent we will see some of that happen.
I would just say to that as well, Phil. We do have, a number of infections in at least 17 communities here right now. So, we might not be aware of travel between communities or even between provinces, but I think is evident when you understand the deep, family relationships between communities across Saskatchewan, but most particularly in our Hutterite communities, that there is travel that has occurred, like there has been outside of Hutterite communities here in the province. And likely there has been, some community travel, but in the same respect, I have talked to some leaders in Hutterite communities as recently as this morning that are foregoing attending a funeral of a young family member because they are in a different community, and they are foregoing that event to support their family members in another community due to COVID-19. They're making the very same sacrifices that each and every one of us is often being asked to make, too often being asked to make across Saskatchewan. So, the travel that has occurred between Hutterite communities would be similar in the travel that we are seeing outside of Hutterite communities between communities, and the decisions that we are asking our friends in Hutterite communities to make are the very same decisions that we're asking each and every person in Saskatchewan to make, and they're making them.
We'll take our next question on the phone line.
We have Allison Bamford from Global.
Hi there. My question is in regard to COVID testing. We've been hearing from a few people that they've had to wait upwards of a week just to get a call back to schedule an appointment to get tested. I'm just wondering now, with the universal testing going on, are we seeing a backlog right now, or are we expecting to see a backlog, or what would be the reasons behind having to wait so long just to even schedule a test?
Do you want to speak, and then I'll speak at the end?
Yeah, so that has been flagged as a concern, and there's ongoing discussions how to, speed up the testing pathway. So it starts with a call to 811, for example, and then the testing centers are being staffed up again to accommodate a larger volume of testing. 1,200 plus yesterday, and obviously sometimes there has to be a bit of a prioritization. For example, if you're a healthcare worker, you're symptomatic, you are first in line. So sometimes there needs to be some ability to wait for a bit, especially if asymptomatic. It may take a day or two, but there is now attempts to streamline testing and speed up so that you don't have to wait too long to get tested, and similarly you don't have to wait too long for test results to come back. But there is prioritization for example, healthcare workers, people who are sick in hospital, to get tested first. But there is capacity to make sure that everyone gets tested in a timely way, and to make sure that there's appropriate staffing, if not 7 days a week, at least 5 days a week instead of 2 to 3 days a week, because testing volumes had gone down to a level where some of the testing sites were only staffed 2 or 3 days a week, and that was fine maybe 2 or 3 weeks ago when our overall numbers were low. Certainly there's been a ramp up of testing capacity in the southwest and center west, but there may be a need to ramp up throughout the province, and generally that is a positive thing, because again, after yesterday, we have seen 2 community transmissions in the PN area, and that's good. You should make testing easily available, so someone needs to get tested for whatever reason they get tested, and if overall test results are negative, that's reassuring. If you have a test positive, at least a person, if they were symptomatic, they would be isolating in any case, but then that allows for a case contact investigation to prevent further chains of transmission.
I would just add to that if someone is waiting a week to have a test done, that's too long and it's unacceptable, and we most certainly need to do better if that is the case, and we will do better. There's a water level here that we're trying to achieve across the healthcare system. We're reopening, reintegrating our surgical capacity, our other healthcare services, and just finding our level where everyone is ensuring that we're able to do as much as we can possibly do. Get back up to some degree of surgical capacity here in the province, ensure that we're keeping our health centers and our long-term care centers safe, but also ensure that we have the capacity to not only do the testing that we have today, which is 1,800 to 2,000, but to increase that in the days ahead. And so waiting a week is not acceptable. We have just completed an agreement with the federal government where the Safe Restart Agreement, where there are funds being provided for us to further increase that testing beyond that, and part of that is to ensure that we have the staff in the appropriate areas so that we can conduct some aggressive targeted testing at times, like we did in La Loche on door-to-door basis, like we are doing now in a number of Hutterite colonies, and like we may be required to do in other communities in the future. Still keep our surgical efforts and capacity there, still keep our ability to keep our long-term care homes safe, and ensure that we're able to do all of this and all of it in as efficient manner as possible. So 1 week is not acceptable, and we need to do better than that.
Do you have a follow-up question, Allison?
Yeah, I'm just wondering, I guess, why would staffing have been dropped when you did plan to introduce universal testing?
And we don't have anyone from the SHA today, but I think part of it is really that you want to maximize the efficiency of testing sites. So if there was very low uptake, in that case, it may have made sense 4 weeks ago to say that instead of being accessible 5 days a week, we'll go down to 3 days a week. But for the most part, testing would be in people who are asymptomatic or mild symptomatic. But of course, it needs to be fast-tracked if you are seriously unwell or have significant symptoms. But again, I think we're in a new stage now where we do need to expand testing just to reassure us in terms of so as not to miss any transmission, and so that is being expanded to just accommodate what we are seeing now, an increase in testing numbers, which again I think is important as we enter into the fall. we do want to see a high level of testing because we will see more coughs and colds again in the fall, and so we anticipate there'll be more need to do testing because more people will have symptoms consistent with COVID as we saw in March and April.
I don't know that staff has been dropped. I don't know if that is a correct characterization. The SHA would have to answer that. But I would just say that Dr. Shahab had spoken to some of the priority of testing, and our test numbers are up. We're up in that 1,300 range most of the last week here now. Which is higher than we have been before, which is a good thing, as there is a need for it. But some of that very targeted testing does take some additional resources as you travel out to specific communities, in this case Hutterite communities, but we did a very similar testing effort in La Loche, going door to door in that community, and that does require some additional resources when you compare that to opening up your test centers in mostly larger communities around the province. So I don't know that there's been a reduction in staff, but there's been a prioritization on where the tests occur, and sometimes that requires a little larger staff complement to achieve what we need to achieve with given the current circumstances.
We'll take our last question on the phone line.
We have Michael Bramadat Wilcock with the National Observer.
Hi there. Michael from the National Observer. I was calling. I wanted to ask, since you mentioned your northern plan, and it sounds like you're basing the way that you're dealing with the Hutterite colonies in the south a lot on your northern plan and the drop in cases in La Loche and so on that was successful, you say. So as cases are rising in the south, what steps are you going to take to stop COVID from coming back up north again, now that we've dealt with our problem to a certain extent?
I think, I would go back to the steps that have kept, cities like Regina and many other communities in Saskatchewan with very low COVID numbers, is the ability for us to disseminate public information and to disseminate information around the public health guidelines, the public health recommendations, and how to stop the spread of COVID-19. And I think that has the efforts that we have undertook in the north, for example, being on the radio in a number of different languages throughout the north, communicating what the public health recommendations are would be an example of efforts that we took specific to northern communities, as well as the vast numbers of healthcare professionals that have been in multiple northern communities for weeks in many cases. The public information has gotten to many of the northern communities, not all and not every one, so there's always additional efforts that need to be made. And then ultimately the voluntary compliance of the individuals in identifying what those public health recommendations are and ensuring that they are complying with those public health recommendations. That's how we've had success in the north. That's how we've had success in some of the early Hutterite communities that were first hit with this COVID-19 virus. They are on the backside. The only reason they're on the backside is they have taken and made the efforts to educate the residents there as to what the public health guidelines and recommendations are, and then voluntarily comply with those. So what works in the north does work in the south. It works everywhere, but it's based around those two main themes: is to educate ourselves. And that's on us and Dr. Shahab and myself and the government and all of my colleagues, as well as everyone in this province, is to disseminate that public information around the public health guidelines that are in place. And ultimately, it's on each of us as individuals to voluntarily comply with those guidelines. It's worked for us thus far, and it's going to be what speaks to our success in the future.
Do you have a follow-up question, Michael?
So there was recently a case in Montreal Lake Cree Nation, which is between Prince Albert and La Ronge, Montreal Lake, and it's going to be lifting in a couple of days on July 24th, I believe. I'm wondering if you have any additional concerns regarding, cases that continue to be in the north. I know that they have gone down. But as cases rise in the south, is there a potential for more action to need to be taken to avoid another rise in the north?
Potentially, again, we always work with the local leadership on, whatever challenge we may be faced with. And it's different in different communities, although our action is very much similar in the collaborative approach that we have with the local leaderships. I was familiar with the case in Montreal Lake simply because I live in that area and had heard about it at, I suppose, the ground level when I was home on a weekend, and I would just applaud the leadership in Montreal Lake, because I had also heard that they had taken very swift action with respect to educating the community on the public health recommendations, and they had very swiftly moved to limiting travel in and out of that community from what I heard at the very ground level living in a neighboring community. So my hat's off to the leadership in the Montreal Lake community. Anything to add to that, Doctor?
Yeah, no, I think it starts with all the things we discussed, that no one should feel concerned when they seek testing that they'll get stigmatized or they'll get blamed for getting COVID. It's no one's fault, so people should feel comfortable to seek testing wherever you live, and then isolate if you're symptomatic right away, even before you get tested. And then if you test positive, again, public health and the community should support you and your family members in terms of if you and your family members have to isolate, your needs are being met. And many northern and small communities have done that in a way, neighbors and others supporting families if they choose to seek that support, and that's really helped sporadic cases which will happen throughout Saskatchewan becoming bigger outbreaks. And I think we just need to be vigilant throughout Saskatchewan, north, but also anywhere in Saskatchewan. And the situation in the southwest and east central, who had no cases for 2.5, 3 months actually, but now suddenly are seeing increase in cases. A reminder for all of us that anywhere in Saskatchewan, the basic principles apply: physical distancing all the time, mask use when indoors, isolate when ill, seek testing, and that's the best way to prevent cases from becoming outbreaks.
Thank you, everyone, for taking the time to join us today. That concludes our press conference.